Hi everyone, hope you're all doing really well. I mentioned in my introduction video that I had a baby daughter who was born 6 months ago, and I mentioned in the same video that I would maybe do a separate video on my birth and labour story. I ended up having an emergency C-section, which was horrible. My due date was given to me as the 31st of December 2014, and on the 28th of December 11:30 I went into labour. Didn't really realise I was in labour at first. I thought I had an upset stomach. I was on the toilet for probably about an hour just trying to do something, but nothing was happening. I just kept having these like cramps, like I needed to go to the toilet. It kept coming and going in waves, like every couple of minutes. Eventually I said to my husband, I think I might be in labour. And it's like, oh okay, we'll ring the hospital. So I rang my midwives at the maternity unit and said I thought I might be in labour, but I was like convinced I couldn't be because my contractions were coming really fast, really quickly, whereas I was expecting it to be kind of a gradual process, get closer and closer and be quite spaced out at first, but no, mine came up bang straight away, one after the other. So went into hospital and they said you're actually only in like latent phase of labour, but the way the baby was laying was making my contractions much more intense, so they kept me in rather than sending me home, and I think I was only about 1 centimetre when I went to the hospital. So I kind of started my birth plan. Anyway, nothing was happening. I think I got to the hospital about 1 o'clock in the morning. 3 o'clock in the morning came, my mum arrived to support me with my husband. Nothing was happening. I'd only gotten to 1 centimetre. Was gas and air all the time, in and out of the birthing pool. More and more hours went past and I just wasn't dilating, nothing was happening, but my contractions were really quite painful, and they ended up giving me morphine. I think I don't really remember it because of the morphine, but I remember they had to stretch me to 3 centimetres. And then they had to stretch me again to 4 because I just wasn't dilating, and then by the late Monday afternoon I was bleeding quite heavily and they couldn't work out why I was bleeding, and it just so happened that one of the midwives on the consultant-led unit happened to come into the room to speak to another midwife, and she took a look at me and said, I'm not happy with the amount of blood that this woman's losing. So they took me straight down to consultant-led unit and hooked me up to an epidural. So had the epidural, which was a massive relief. Obviously going through all of those contractions since the Sunday night, the night before, only having gas and air and morphine. That was a huge relief. But then they decided to give me the drug that helps progress the labour, because by this point I was still in latent phase of labour. They gave me, is it the syntocinon? I can't remember what the drug's called. But the baby didn't like it. Every time they were putting the drug in and the epidural was being topped up, my baby's heart rate kept dropping. It would like jump up to above 180 and then drop below 80. So they really wasn't happy with how she was responding to the drugs that they were giving me. So they did all kinds of tests. They had to check her oxygen. So they kind of scratched the top of her head to test the oxygen level in her blood, which was kind of borderline, they weren't happy with. And then eventually about 9 o'clock on the Monday evening, they just started talking about maybe having an emergency cesarean section, which I really didn't want to happen because I'd heard such horror stories about epidurals not working properly. I just really didn't want to go through the recovery time. So obviously, inevitably, it was taken out of my hands. They just really weren't happy with how my baby was responding and labour wasn't progressing. So they took me in for an emergency C-section. And I remember laying there thinking, don't look around the room, because I thought if I clap eyes onto any of the instruments that they're going to use to cut me open, then I'm going to start freaking out. So I was just like fixated on the ceiling. And I remember them pinpricking me to test the epidural, but I could still feel it. So right at the last minute, they said, we need to give this lady a general, because I could still feel pain. And so yeah, they knocked me out. My husband had to leave the room. 10 minutes later, apparently they took my baby daughter out to my husband and stitched me up. And I remember waking up in recovery, and I remember looking at my mum saying, Mum, I can't do this anymore, I'm tired, I need it over. And she took my hand and said, you don't need to, darling, it's done, you know, your baby's here. And apparently I just looked at her and smiled. This is all still quite hazy because of the anaesthetic and the morphine that I'd had. I just remember bits and pieces of it. When my daughter was born, she was tongue-tied, so breastfeeding was quite difficult. But apparently she had some really good feeds on me when she was first born. So yeah, that was that. Recovery of the C-section, physically in my body went really well. Mentally, I struggled with it. I really struggled. I felt after the first couple of days, once all the anaesthetic and the drugs were out of my system, I really struggled to bond with my daughter. I completely felt that my body had let me down, and my body didn't do what women are designed to do. I didn't feel my daughter come out. I didn't see her come out. All of a sudden, I went into a room pregnant. They put me to sleep. Next thing I know, I've got a baby girl. Which I found really difficult to process, because most people that you talk to talk about this whole Disney image of what it's like transitioning into motherhood, and how it comes so naturally, and it just isn't like that for everybody, unfortunately. And unfortunately it wasn't like that for me. Like I say, I really struggled to bond with her. I was emotional, I was crying constantly. Breastfeeding was really difficult. As I say, she was born tongue-tied, although only mildly. The aftercare that I had in the hospital was quite bad. I had lots of different advice, wrong advice at that, on how to breastfeed a tongue-tied baby. Evidently, after 3 weeks of on the breast, off the breast, on the breast, trying to breastfeed, I had to quit. It just wasn't happening, and the more and more time that she was spending away from me, feeding from me, the more difficult it was becoming. So I had to make the decision to stop breastfeeding. So kind of I had all of these things going wrong, everything, my whole birth plan, my whole journey going into being a mother went completely wrong for me. I still get quite sad about it now. I'll watch One Born every minute, and I'll see a cesarean section, and I'll just be in floods of tears going, oh my God, that was me, and that's what they did to me. And then on the flip side, I'll see somebody's birth story that goes 100% to plan, and how happy and lovely it is, and those first special moments that you get with your baby. I didn't get that. It actually makes me quite jealous that I didn't get that. And that makes me quite sad sometimes. And it can be quite lonely when you feel like that. And it's only after speaking to people, since obviously having my daughter, about my experience, and that the amount of people that go, do you know what, I felt like that after my C-section, and yeah, you're right, it's not as easy as that for everybody, and it is difficult. And I didn't feel lonely anymore. So yeah, had quite a tough time emotionally after my daughter was born, but lots and lots of skin to skin contact with her. When my husband went back to work, was better, because it was kind of then forced me to deal with my daughter and bond with her, and which helped a lot, and speaking to other people helped a lot as well. I was quite lucky in another way, because physically recovery, I say I healed really well. My incision scar is so neat and so tidy, and it's really low as well. Nobody is ever going to see it. Hopefully, if I ever get back into a bikini and feel good, nobody's ever going to see it because it's so low. I had my mum around to look after me. She kind of helped do all my housework for me so that I could just sit and concentrate and bond with my daughter. So yeah, that's my thoughts and experience on my C-section. As I say, if any of you ladies out there have had a cesarean section and feel unbonded to your child and lonely and emotional and sad, you're not alone. It's really quite normal, and I do encourage you to talk about it a lot, and don't be afraid to talk to other people, and don't feel like if you do talk to people that you're going to be coming across as a bad mother, that you should have these feelings that just weren't there. So do talk about it, and do get help. I actually had a good service at my hospital called Birth Afterthoughts, which is a very good service, and I basically just went to my hospital and sat with a midwife supervisor, and they talked me through my birth plan, like my hospital notes, like bit for bit, from the minute I went into the hospital, why this happened, why that happened, why did they do this and why did they do that, why my body wouldn't have been doing this. And they talked me through everything, which helped me to understand what happened a little bit better and kind of have a little bit of closure. So yeah, but if any of you have got any questions about it, comment below, I'll try and answer them. But that is my birth story. So I hope you enjoyed that. I hope some of you might find it beneficial listening to me. So yeah, leave me any comments, any feedback, much appreciated. Thank you for watching. Bye.